friends. Welcome to the Ancient Health Podcast, where East meets West. And I'm your host, Dr. Chris Motley. And guys, I'm super excited today. For all you guys watching or listening, I am really a big fan of Dr. Seb because one thing is that I've always regarded and respected how the teeth affects the whole body. We became buddies online. And he's a busy man. He's a busy doc, just crushing it over in England. But I'm really excited because I wanted to be on the podcast because he has such good information online. Dr. Seth, thank you so much for being on the podcast. And I really appreciate it, my man.
Likewise, right? I think we're all doing our thing across. And this is what I was just saying to Christy, actually, that all of us in each part of the world is taking the best part of everything and bring it together so we can feed to everyone the knowledge that's out there to support themselves with really truly being your own kind of medical profession nowadays, because gone are the days where you go and you don't know anything and you have to be so studious to understand what's going on. You can watch videos, you can listen to podcasts, so much info out there, right? So this is how we actually get out there. And likewise, with you being so busy and fitting me into your schedule. So I appreciate it.
Brother, I really mean this. Everybody listening, it's just like when you know people out there are kindred spirits, and the kindred spirits being like you can tell you care about individuals, and the information that you give freely to help people, like it makes me always want to have camaraderie and really because those people want to help others, and this is a great opportunity because. And I'm not going to take anything away from the podcast because I could start going down through some memory lane about teeth according to like some of my Chinese medicine training. But first, truly, you have such good social media presence and you're very articulate. And I want people to please follow him. But first, can you tell us about yourself, about biological dentistry?
Yeah.
People ask, what's your passion? Why do you go into this the first time?
This is, I get shivers telling this story every time, and I will try and keep it to a 2-minute quick thing, right?
No, we love stories. I love stories. That's where I get involved. So this is great, my man. Don't worry about that. Yeah.
For me, being a kid, I loved science, astronauts, flying planes or trying to fly planes and, all of that kind of stuff. I was drawn to it in school. My parents were like, well, what do you want to do? And obviously it's like doctor, dentist, scientist, pilot, I don't know, something like that. Well, anyway, I went and did some work experience. I don't know, must have been about 11 or something. And I ended up going to this dental practice. And my first mentor in dentistry, she was from Sri Lanka, actually. She was running a practice in my local town. And I went there and she said, I just did the week, the school thing where you observe and you learn. And I was like, can I get a job here? This is back in the day when you could literally she was like, yeah, come on a Saturday and you can work on reception. So I ended up working on reception in this practice when I was like, I don't know. Oh no, to start with, it was just shadowing her.
Yeah.
And you would, to be a dental nurse back then, you didn't have to have any qualifications. You would just be trained by the dentist. And then you would go and do the thing afterwards if you wanted to do it. So I was on a Saturday, she'd be helping me out by having me in and helping patients. So she's like, do you want to work? Because she said, oh, you're good at talking to people. Do you want to go on reception? Anyway, I did this for like 7-8 years, working as a dental receptionist, a dental nurse from the age of like 11 to like 17, 18. And
wow.
Crazy. So I had this weird affinity to it that I just loved back then. And I mean, in the UK, it's crazy to get into dental school with the grades that you need. And I would say that, am I an academic by nature? Probably not. I have to put a lot of effort into learning, understanding, and I listen to things to learn. And I didn't realize that until later. So my school years I'm not very good with the visual and the reading. I had to listen to things. So all the days of recording and playing back when I was at university, I was like, oh, this is so much easier. It's going in now. But so I then got to this, I suppose a side parallel to this was I love sports at the same time. So for me was any sport I did, I was pretty good at, but my main sport was boxing actually. And I was semi-professional in a way in the amateur like arena. And I didn't actually box or spar or do any bouts with anyone until I was training already for 4 years, because I just enjoyed the training for fitness. That's how much I
Yeah.
loved. And so then I had a bout, my first bout. I won it in 30 seconds, and the guys were like, "Oh gosh, we need to get you into the nationals. We need to do something." So I ended up first year of fighting, or you'd call them bouts, with the head guards and all that stuff. And I got to the quarterfinals of the England champion. In fact, it was the UK championships, and got qualified for ducking too low. Crazy. I don't know how you could even do that. Because I was quite small and short, and everyone was tall and long. So the only way I could get in there was to, the Mike Tyson, right? To try and get
totally. Like when you're pulling in. Yeah. Yes.
So, but that required a lot of effort alongside the study. So it was dentistry and it was boxing. They were my two passions.
Wow.
And when I got to 17 and I did my A levels here in the UK, I completely flunked the first year. And then at the end of that, I got to the semi-finals of the nationals that year. That was the third year that I tried. And I lost the fight that I would have been going into the Olympic training camp in. So then for me, that was like a sign saying, right, you didn't win that. You've got to decide now, do you want to try and be a professional boxer, or do you want to retake that year and try and study to get to do what you wanted to do? So I didn't retake the year, but I just studied alongside to take extra exams in my final year of these A-levels before you decide to go to university. So I didn't end up getting the grades to get into dentistry. And my fifth choice of university was chemistry. Yeah. And I thought, okay, maybe I just wanted to be a dentist for the money. Maybe that's all it was, right? Yep. And I went and did chemistry, which I absolutely hated. And this is where I learned that I could be super studious and super academic just by listening, understanding, learning, talking to my friends on the course like this, understanding how to do things rather than just trying to read from a book and really, playing it out. Ended up getting a first in that degree. And wow. I know, and I hated it. So, that was the foundation of like me understanding the biochemistry in the body, how the cellular signaling works, how we as humans function from what we know, right? And there's a lot we don't know, from a science perspective. But that meant I was very rooted in, Western medicine, Western understanding of interaction of things. And my family aren't medical, really. No one's medical in my family, but I was led down that route, like pharmaceuticals, private medicine, blah, 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 blah. So then I said, right, I'm just going to get a good job with good money, working in London, earning, I went straight into like an IT company. Do you know like IBM, right? A bit like IBM, but it's the Japanese equivalent. It's Fujitsu Services. So
I have their scanner. It's great. Yeah. It's amazing.
So I went in with those guys and was really good at my job and hated it. And I was only looking forward to payday, and that I would be bored the rest of the month. And I met my wife there. And during this time, I went traveling just before I did this job around South America. Ended up I did Brazil, Argentina, Peru, Bolivia. I got very ill though in Bolivia. And I ended up in intensive care for a week with pulmonary edema, heart murmur, pneumonia. And that is pretty much the turning point in my life, because that, Western medicine fixed me. And I got shipped back to the UK, starting this new job where I met my wife in my early 20s, having fun, going crazy, drinking alcohol, whatever you do, and realized that my immune system was not where it should be. And I was just illness after illness after illness, being sick all the time, having skin problems, having no energy, feeling really depressed. And it's quite funny, my other half and I were talking this week because she was looking through her old messages to her mum, and she was saying, "Oh, Seb's so depressed, he doesn't know what to do." And it's like, you forget these moments that define you, right? So during this process and this private medical care, nothing was making me better. I was having anti-parasites, antifungals, antibiotics. No one knew what was going on. They just prescribe, making me worse and worse. By the end of it, the antibiotics or the antifungals, whatever I was on, everything was coming back after the first few days, even when I was still on these courses of antibiotics. My wife,
Mm.
luckily to me, is very, very holistic. Her family have a homeopath, have a nutritionist, knew about the microbiome. So
Yeah.
she led me down this path of understanding more. And yeah, but it took me a year and a
Wow.
half to realize that, of trying the conventional way, right? So then
Yep.
when I realized that she was right, I ended up going, okay, I'll hold my hands up. Let's try all this stuff. And in that process, we went to an immunologist that I had healthcare cover for, and he was about, he must have been 85, I reckon, and he was
What?
still working, yeah. And he's this professor of immunology, and the first thing he said to me was, "What are you doing with your life?" And I said, "Well, I'm in this job that I don't really love." He's like, "Well, what did you want to do?" And I said, "Well, I did always want to be a dentist." And he put me in contact with King's College London, the admissions guy, and that's what started the ball rolling. And so I got back into but it was only after I'd learned all the lessons about, bringing everything together, nurturing your body, looking after the bugs that are in it just as much as you. So I had to learn those lessons to bring, or to even have awareness of what biological dentistry would be, or eventually be in the UK. And it's what the other crazy thing about this as well, Chris, is that the same time my wife had had 4 extractions when she was younger,
Yep.
and a bit of crowding, but they took 4 teeth out and made it straight. And then she, in her early 20s, had headaches, migraines, couldn't sleep, anxiety. And we later, or during this process, we realized that that was about her airway, her clenching, her jaw, her sleep at nighttime. So in tandem, she was going through this expansion process that we took ages to find in the UK, by the way, back then, of someone that was just making everything bigger, that cranial osteopathy would like relax her jaw muscles so much. But then after a few weeks, she'd get headaches and migraines again, and she'd have to be in this constant cycle, right?
Uh-huh. Yeah.
Um, so she was learning having the physical structural stuff done to her,
Yep.
to relieve her pressure, and I was learning about the microbiome and the gut and everything at the same time before I even went back to dental school, which I always wanted to do when I was younger. So it was unbelievable.
So when you got that training, like the microbiome, and then you saw what she had gone through, so you go back to King's College, because I've heard of King's College, very prestigious,
Mm,
and you go to King's College, you start training, and you already have a mental note of going into like the biome and how your gut and everything's related to the teeth. And I'm not trying to shoot too far ahead. So when
yeah,
you're in school and you're
yeah,
learning all the things about teeth,
yeah.
did you already have a mental note like it's all interconnected? The teeth is connected to everything.
Absolutely. Absolutely. And the funny thing was, I didn't end up going to King's College in the end, because there's in the UK there's only 4 courses that you can do an acceleration on. Because I'd already done my chemistry degree, I
Oh
didn't have
yeah,
to go
yeah,
back to do dentistry for the amount of time that was, if you came straight out of
yeah,
like high
yeah,
school.
yeah.
So I ended up, there was King's College, there was one in Wales, there was one in Manchester. And I looked at my savings in my account, and I thought, I cannot even put a deposit down on a house in London, and I'd spend it all doing this dental school. So we ended up moving to the north of England, which is where my
Wow.
wife was originally from. So I ended up studying, it's called UCLan, and it's a very new university, or was when I started.
Yeah.
And it's now known as one of the best dental schools, because you go in, you do 2 years in one of the academic stuff at the beginning, all the lectures, everything you need to know. And then the final 3 years of the university, you're just working in the National Health Service Institute, because there's so little dentists up there, just training, doing dentistry all the time. So it's like an apprenticeship for dentists, right? Which makes
That's
sense.
amazing. That's how everything should be. Like, because
Yeah,
like you have
yeah,
hands on, so you have the hands on experience.
yeah. But the problem was, I was far away from all the thought leaders in the UK about biological dentistry, right? So I, we knew, or I knew, or the two of us knew, that this is something that I had to do. And I wasn't going into dentistry to do cosmetic dentistry, to do aesthetics, to do anything like that. It was about the health of the person, because it's what had changed my life from a
Mhm.
microbiome perspective, but also changed my wife's life with the structural, the airway, the breathing perspective. So in my reading weeks, summer holidays, I was going shadow. My parents live in the south still, so we could go down and shadow dentists down there that were doing
Mhm.
the in London, that were looking at this already. My wife was going to a guy in Sheffield, which was about an hour away, to do her braces and her expansion. So I was learning from him. I'd go into every appointment. And then luckily, the practice that I now own was the one where my mentor had. And so I was just, and it was probably an hour from us as well. So I would
Yeah.
go and just watch and learn the whole weeks every time I was off, just understanding his way of doing things and learning from it. So, but then I would take this knowledge back to dental school, and I'd be taking a tooth out, and then my tutor would come over and she'd be like, I'd be like scraping the socket to get all the infection out of the jawbone. And she'd be like, "What are you doing? You're making it bleed more." I was like, "No, I'm getting the stuff out." And then she'd be like, "No, no, no, you can't do that." It was so funny.
That's amazing.
Yeah.
I mean, so she was thinking like you were already progressive in that time, like
Yeah.
while you were in your apprenticeship and you were already
Yeah.
doing that. And that's
Yeah.
so okay, with your wife, like when you learned from the other doctor about her airway, and I'm not trying to shift gears too much, but that's really an important subject. Like even in dentistry, you
Yeah.
hear individuals have airway issues and stuff. What happened? Did she get her airway,
Yes.
obstruction from the teeth corrected?
Like you are a body worker, right? You support the
Hmm.
body to get back to balance. She had to go to osteopathy to relax her jaw muscles to release all
Mm,
the
mm.
tension around her jaw, but it would only be so long until it all came back. And to start with, it was every week she had to go. Eventually, they got it to like every 8 weeks, but it would always happen at that 8 week. And then she did so much research online, looking that I need more space, I need more expansion, but there was no one really in the UK offering this.
Oh,
So we ended up finding a few, and there were so many opinions, right? And this is something I tell all my patients: you've got to feel what's right for you, because I have my way of working, another dentist will have their way of working, and it's just what tools they use to get to the same result. Like she had
yes.
consultations with people that would say we would relax the jaw forward with splint therapy, would then do surgery on the jaw joint to like try and put the jaw joint back into its position because it's not captured right. That's what's causing all that muscle spasming and stuff like this. And it just didn't sit right with her. So she kept searching until she found someone that says, "Oh no, just need to open up those spaces where your teeth were lost. The jaw will then naturally come forward when the muscles relax, and then you'll be fine." And she broke down crying in the chair, right? Because she knew that was what was right for her.
That's amazing. It is true. There's times, Doc, that, when people do come in, they say, "What do you want me to do? What do you think?" I was like, it has nothing to do with me in that respect. You need to find
Mm.
out. And I love stories. That's why I get lost in. Like one thing, guys, everybody out there listening, is when Dr. Seb talks about like boxing. See, my brother was in Golden Gloves, and
Mm.
this is a funny story. It's not that I was actually good at this, Seb, but he would take me to the gym, to this it's a pretty rough gym back in the day. And they would have these contests where they would do jabs back and forth. So they say, "You hit me, I hit you," like fast jabs.
Oh yeah.
And I remember my face would be numb by the time of the day. And I was like, why am I doing this? And then, but it did teach me to take a hit. Like I wasn't afraid to get hit in the face. I was like, well, I'm going to get hit. And, so I got so used to it that's one of my main ways that I like to train too. Is like, but I'm not saying I'm good. I'm just, my brother is really good. I'm being, but
Yeah.
I learned how to hit. I mean, I learned how to actually hit.
And it's the
So
best, right?
yeah, it's, to me, it gave me confidence, and I'm just saying it's one of the best workouts in the world. Like I'm just gonna say bar none to me. So anyway,
Mhm.
I know we're talking about dentistry, but I want to ask you a question. Like whenever somebody asks you, because people ask me, they'll go, "Doc, what's the difference between a regular dentist and a biological dentist?" What is like your way of explaining that?
Um, I think for me, it comes down to looking, okay, the whole person rather than just the function of teeth, I suppose is the simple answer. But
Mm-hmm.
for me, it's looking, well, let's rewind. If someone comes to the clinic and the consultation, the things that I look for is
Mm-hmm.
obviously listen to what's happened in their life, where they're currently at, and actually try and support with what you think is going to help them get to the point of most relief. Because really, the diagnostics are not that great to say, right, we'll remove the metals from your mouth and you'll feel better. We'll take the root canal out of your mouth and that root canal and it'll be fine. You don't actually know what percentage of anything is going to relieve the body so much. So I always say that you start with the easy, low-hanging fruit things and build up to the more invasive as you go.
Mm.
What I kind of say is that for me, removing, so if you think about the conventional dentistry, you look at the chewing ability of the tooth and the jaw. You look at the health of the gums, and you look at the decay in the mouth, really. And if you come into specialities, you look at root canals to try and save the tooth. You look at implants if you've lost teeth, and you look at the bite and how that causes or can cause jaw joint problems. But they're specialities. So most dentists just focus on the first three. So then what we look at as a biological dentist is what type of materials are in the mouth, how that can affect your system, your inflammatory markers, your genetic. And that is all, coming and going all the time, right? Your body's always changing. And you then look at how or what signs are there in the mouth to say that this person can breathe well at nighttime or can't breathe well at nighttime, and how that affects their sleep. And what I care about is depth of sleep, right? So if someone can say, oh yeah, I sleep all night, and I'm like, well, do you wake up with energy? And they say, oh, not really, no. So, well, do you have a dry mouth? Oh yeah, I do, yeah. Oh, do you have are your teeth flat? Oh yeah, they are. So what I think about is that's an extreme case when I'm talking about those things, right? But even probably the easiest way of explaining this, the worst end of the scale for this airway thing that we talk about as a dentist is sleep apnea, right? Sleep apnea is where you can't breathe at nighttime. You have to wake up to breathe because your airway collapses so much. But there's this gray scale that no one really looks at or talks about. And it can be as simple as tongue thrusting to get your tongue out of the airway at nighttime. It can be clenching your teeth to help you breathe by tensing the muscles of the airway. It can be grinding your jaw to move your jaw forward, like the recovery position to help you breathe at nighttime. Or it can be mouth breathing, which is like the bit before sleep apnea. So all of these things are like inflammatory causes within the body, because when you mouth breathe, you put your body into fight or flight, you pull yourself out of deep sleep, you don't get that regenerative sleep. So you're not actually repairing, regenerating, recovering as well as you could be if you're nasal breathing all night.
Oh, see, these are I love those signs and symptoms. So those are the signs and symptoms. So you see like you're talking like teeth grinding, you're talking about mouth breathing, and people not having energy. So I want this all correlate. So since you're able to understand materials, what's going on in the mouth, like infections and such, and I want to correlate even with gum disease, you have passage airway, you're not getting enough energy, infections, they can cause you to have a decrease in energy in the morning too. Are there subtle signs and symptoms of what people out there should look for, around the gums that you would recommend?
Exactly. So the first two things that I look at is the airway signs, and we do something called Airway Stabilization, which I'll talk about later.
Yes.
And the materials in the mouth they're things that could be plastics that have BPAs in them that are hormone mimickers, right? It could be metals that have mercury in them that destroy cells around them and stop those detox processes, cause inflammation in the body to allow you not to function as well as you could do if they weren't in the mouth, using up part of the detox pathway. So you've got less energy to do other day-to-day things, right? The gums, if they're bleeding, if they're leaky, that allows bugs endotoxing, depending on your microbiome, into the bloodstream. So your body's got to fight it off. So it's not focusing on the other things day to day. Or when I look at decay in teeth, I look at a few things, either from cracking teeth from clenching that allows micro cracks and things to get into the teeth. And it's we call them abfractions. And abfractions are areas of the teeth where the loading is too heavy, and it manifests as the weak part of the tooth that breaks and causes on an x-ray it'll look like decay, but in reality it's really the loading, and most dentists will call this decay. It's really the overloading of the tooth system and the structure so that it's breaking down too quickly. And that can be, one, the structural component because of the airway, or two, the internal nutrition feeding systems to the teeth, and they're not replenishing as much as they're being lost, right?
Yes. And totally, when you have that leaking mechanism, and you could have the loading and the decay in that from measure. This is so interesting to me. So everybody out there, I don't want to go all over the board with Doc here. So what, you're talking about BPAs, you're talking about metals, talking about infections, and this is a very general question, Doc, but what would be sources like for BPAs, for metals,
Yeah, that's a good point.
some things that are happening daily in people's lives are like, that's what I consume or that's what's on my body, and it can show up in their teeth.
Yes. Yeah. So the well, let's start with in the mouth. So if
Mm-hmm.
you have a white filling in your mouth, I would say probably 60% of the manufacturers out there will have more toxic components within that composite filling, or composite, as you guys say, and that
Yeah.
that would be the it's basically like a mixture of all these plastics that are then set and polymerized together, but they don't
Mm,
always polymerize completely. And those monomers, the smaller ones, here's my chemistry coming into, leach into the system, right? And then they
yeah.
act as the hormone mimicking estrogen a lot of the time in the body, the plastics, right? Which
Yeah.
disrupts females more than males, but has its own problem in males too, right? Later down the line, especially with the whole prostate stuff going on.
Yep.
But when you've got plastics, you've just got to ask your dentist, if you're having a white filling, can you use a BPA free, BIS GMA free, whatever one it is? And I'm just trying to give you the brand names, but they might be completely different over there, to be honest with you. It's probably just best to ask them that generic question.
Yep.
Metals in the mouth, there's obviously the classic amalgam filling, the silver filling that they called it, which is 50% mercury. And there's so much research now that this shouldn't be in the mouth and that it disrupts the cellular signaling. Even worse, if you have gene mutations like the MTHFR and the
Oh
detox
man.
pathway blocker, it just, your body can't get rid of the metals, can't get rid of the, there's another one as well, the APO4E, I think it is, isn't it? That one that makes, if you've got metals in your body, it's more likely to cause Alzheimer's because it pushes it into the fat tissue, which the brain is some. So, and these
Oh
are
my.
things actually, if you think about it,
Yeah.
the
Yeah.
metals in the mouth, the plastics in the mouth, like we have like toxic things like, I don't know, you're using a hair gel that has something in that's not good, or you're using
Yes.
something else, or you're brushing your teeth with, something in there that's not right. You're not doing that all the time. But if you have fillings in your mouth, they're constantly in your body. You're constantly detoxing from them. So that's, for me, is like, just, you need them out of your system, right?
Exactly. Exactly right. You have to have those external sources, some internal sources. And when you, that's what I love about biological dentistry here in the Nashville area, doc. They'll have, I remember they had like one doctor here that was pretty prominent when I first moved here. This is a long time ago. Now there
Mm,
are like five or six that I know that do, and I'm thankful. And they're all, I can tell like all of them are pretty friendly to each other, and it's really great. And I try to recommend that to everybody out there when you're talking about knowing what's going on, like researching further within the teeth or within the mouth. When you're looking at everything, airway, metals,
mm-hmm.
toxins, infections. One of the things I want to talk about too is this could all lead to the loading,
Mm,
degradation, and then it could lead to having the need for a root canal or
mm-hmm.
something of that sort, or having cavitations. Now,
Mm-hmm.
I'm always very conscious about talking about touchy subjects, and I don't know how it is in the dentistry world, but
Yeah.
when they talk about biological dentistry, many people out there will say, "Yes, I've been told that root canals may not be the healthiest, and sometimes there could be cavitations." Can you touch a bit on those in
Definitely.
the style you'd
Yeah.
like to?
I mean, to me, it's not controversial at all anymore. There's so much info out there. And remember when I was saying you start with the easy, low hanging fruit and you build up. So how I
Yeah.
would do that is you do the airway assessment and you do what we call myofunctional therapy and using appliances to help you breathe better at nighttime.
Oh,
It's like the foundation. You then look at removing the metals in parallel, getting the gums healthy and removing any decay at the same time. That's
mhm.
like your foundation. So when you've done that and you've stabilized the basics, you then look at doing more surgical interventions if needed. And surgical interventions are if you have a dead tooth in the mouth that has an abscess on it, if you have a root canal in the mouth that has an abscess on it, or if you have a previous extraction that has left a low grade chronic inflammatory fatty tissue in the jawbone as I don't know why it happens, but Professor Gennati just released some research, right? And this is this week that I read this, that if you have a normal extraction from a dentist that doesn't use ozone, doesn't use plasma from the blood, and doesn't uh, pack that back into the socket that's been removed, he
Yep.
said there's after 6 months, there's 48% loss of vertical bone height in the jawbone,
Whoa.
38% loss of horizontal bone loss after 6 months, and 100% cavitations. 100%.
What?
And cavitations are not like, oh my gosh, you test and there's loads of horrible gunk in there. It's more like, yes, that is a potential, but more so, it's that there's this fatty tissue in there that your body is kind of like encapsulated to stop it getting into the bloodstream. And it's like so for example,
Hmm.
um, the studies that they do about the inflammatory marker is called RANTES, CCL5. It's like an inflammatory marker that you can measure from taking blood from your arm.
Yep.
Normally, if it's over like 30, I think it's 30 nanograms or micrograms per mil, I can't remember which one it is, but it's over 30. It means that you've got a source of low grade chronic inflammation in the body. And that can come from like rheumatoid arthritis areas, it can come from leaky gut, or it can come from jawbone stuff. And when you open the jawbone and you remove the tissue and you test it from a histological sample, you actually have 30 times higher than you found in the blood. So then you know
Whoa.
that that's the source of the inflammation and your body's crying out for help here, but it can't do anything about it because it's not healing properly.
Oh, I mean, this is amazing, Doc. I mean, I love this conversation. So, when you're finding like uh, this kind of evidence, like in a cavitation, um, uh, I will say I remember specifically I had a patient. I know you have these stories in your
Mm.
clinic, but whenever personally that I could not find like a way to like solve a problem with the patient.
Yeah.
I've had some pretty close friends that would come in, and normally, Doc, you would go, "I should have this done in 3 visits." Like that's how this is not going to take me that long, and then they don't. I really respected biological dentistry because I kept in my Chinese medicine. I kept finding issues with our little volt meters. We'd always check like EAV. We'd check little volts, and I was like, "Well, you keep having a problem up here on your jaw, and I don't
Yeah.
know why, but there's a block here." So I send them off to the biological dentist, and they're like, "You've got a cavitation, a big old hole in your jaw." In one patient, and it was draining, and it literally made pockets, like pockets in her esophagus, like it was catching food, and she would actually close up on her airway. And
Whoa.
like you said, like they had to go in and clean out the cavitation, right? You said it was fatty,
Yeah.
like, they had to clean out, do they have to scrape, like, a certain biofilm or something out of that? Is that what
Yeah.
happens?
Pretty much, yeah. So a cavitation, you look in the mouth where you're missing a tooth, it will just look like gum over the top of it. Absolutely fine.
Yep.
But what you do as a biological dentist is you open the gum, and then you look at the bone and you say, well, that looks pretty normal as well, like nice solid cortical bone. But normally, what you can see is like a tiny little indentation, and sometimes it's where the tissue from the gum is still kind of like wanting to attach to. And I think what happens is that if you imagine, and this is just Seb, not science, but this is how I think that when you take a tooth out, right, and the body, right, creates bleeding in there to try and
Yeah.
heal, the
Yep.
gum goes in and then up. And it's within that in and the up, the bone doesn't form properly. And how we remove teeth is once the tooth comes out, we scrape clean, we ozonate, which is like a gas to disinfect and provide oxygen for healing. And then we put plasma from your arm, like these like all we do is we take blood from your arm, we spin it in a centrifuge, and we pack these like stem cell pockets back into there. So then the gum literally just has to go boom over the top,
Oh, just right over the top.
just right over the top. And I think what happens with a cavitation is it doesn't heal properly. So when you open it up and you've got this tiny little indentation, you push into the cortical bone or drill in, depending on if it's a man or a woman or how strong the bone is. You have this fatty tissue that you lift out and you get rid of it, and that's that inflammatory source, that high percentage of rantes. And that's a really, sometimes I think it's tumor necrosis factor as well, which is a horrible cancer marker in some aspects, actually.
Truly, and Doc, I mean, I'm not trying to get too hyper excited, but I remember because I had a very cool patient, and what you're saying is they're jogging this in my head, and she consistently had sinus infections. And I know you've probably seen this, Doc. I mean, I'm just loving this because
Mm.
she on her right side, and I literally could not. I couldn't like solve it. And again, I have a little like voltmeter, and I was like, oh, there's really low current in this area. So she showed me the surgery, and the biological dentist cut it open, and they were pushing on the bone, and the bone was like mushy, like it wasn't even bone, and they had to scrape it, and it was pushing up like towards, I guess, into her sinus or something. So that's a
Yeah,
big thing, right? Does it make a lot of sinus issues and stuff? Like, because I mean,
absolutely.
that bone was decayed. It was gross, basically.
Yeah, I mean the fancy name for these cavitations, there's two names. There's one called Nikico, which is neuralgia-inducing cavitational osteonecrosis of the jawbone, and that one is basically where the fatty tissue deposits are on the nerves, and you get trigeminal neuralgia type
Oh
symptoms.
my goodness.
So it can cause that as well. The other name for it is fatty degenerative osteonecrosis of the jawbone. So it's basically this area of non-healing, non-blood flow, so the body can't clean it out. So you have to basically open it up, remove the soft, gunky stuff, the soft bone, the necrosed bone, and you have to let the body know basically that this is here to heal. We're trying to do everything re-heal, right? And it's like a flushing out and a starting again.
That is, to me, I am really agreeing with you. I love your information, and I'm saying that, like, I think you should be able to get all the information from the mouth. I'm just saying, like, the mouth tells it all. I
Mhm.
mean, more and more. I'm not saying I don't know dentistry that well, but the more I've like studied like neurological tooth connections, and we can talk about that too.
I love that, by the way, because that's what
I,
I want. Like, I have in the moment no one in the UK other than one guy close enough that does autonomic response therapy testing, which is what Klinghardt Institute kind of teaches. And when there's something that I don't even get or I can't see on an X-ray, I don't understand it, I send them to him so he can tell me which tooth and where it is. But you're doing the same thing with the volt reading, right? And I know there's a few biological dentists that do that in America too.
it is really amazing because um, what I started to do, and I hope this is not boring to the listeners, but whenever you're talking about voltmeter, like I was starting to do that. And so what I would do, I have a little biofeedback device as well.
Yeah,
So I would try to shortcut the system, and doc, I would just push up into their gum line, and they would, and I would get a signal, and they would be like, it always hurts there. Then I would tell them to go to the biological dentist, and I would look at the organ, and I'd
yeah,
say, oh, that's your stomach. And then I go, what's your history? And they go, well, we've had ulcers, all sorts of, gastric issues and gastroparesis. And so then I was like, I started to, at the very beginning of my assessments, not that I was, doing dentistry, I would just do neurological tooth checking, and I would just mark it off on their chart. And I
yeah.
would say, hey, you possibly need to go get that tooth fixed or get it checked, because they were always having a bleeding or something at that gum. And that's why your information's like so vital. And since we know like everything starts in the mouth, it's the first part of your, the alimentary canal. Now, this is hopefully not jumping on another section, because there's so much I want to ask you, my man. But what about now? You have cavitations, you can have all these airways. People get cavities. They'll go, I always get a cavity in this one tooth.
Yeah.
That one question is possibly, why does a cavity always happen on one tooth and not the other one? And then, can cavities be reversed? Like, I know there's a lot of questions, but
Yeah, well, I believe in all of that actually. And for me, there's the physiological way of looking at it, and then there's the way that you look at it as well from the energetic meridian organ energy line part, right?
mhm.
So, the first way that I try and look at it is if someone's always getting a filling, or it's always breaking, or there's always decay under the filling. I always say, well, if you close your eyes and you just tap your teeth together, do you feel like that's the first tooth you contact? And if it is, a lot of the time it's a loading issue thing, right? Because our teeth aren't balanced in that way.
Yeah,
And that will be more often than not how I look at it. And then if there's a tooth that doesn't contact, doesn't um, make sense in my mind why it would have a problem, then we look at right, what meridian line is that on?
uh,
I have one just on my wall, and we go through it and we say, well, let's say that's on the urogenital one, and we say, well, do you have any problems down there? How are your hormones? Like, what's the bladder doing? What's the kidneys doing? And it's just really interesting how much it correlates. And obviously I can't physically in this world ever treat a tooth based on their feedback from what they think their organs are doing, but it's a bi-directional route, isn't it? So then we
yeah.
say, well, go away and look at supporting that organ, do a cleanse, do a detox, take some supplements to help with that. And
Oh,
a lot of the time, things repair. And going into the remineralizing aspect of it, a tooth structure, tooth in the jawbone, let's say that's two roots. You have your enamel on the top, which is like the hat around the tooth, which is the strongest mineral content in the whole body, stronger than bones. And then you have the dentine layer inside the tooth. And the dentine is the majority of the tooth. And that's the same strength as bones, actually. And then you have the internal parts, which is the nerve and the blood supply and the lymphatic flow within the tooth. Because teeth, when they're alive, the lymph system slowly goes from inside the tooth to outside the tooth. So that's why you don't have decay in a healthy mouth, because that lymph system is pushing all the bugs outside the tooth so they can't stagnate, eat their foods, release their endotoxin, dissolve the teeth, right? So the problem is that becomes stagnated if there's a lot of clenching on the teeth, because you are pressing the teeth tightly, the lymph system is cut off. Sometimes when you bite too much, the tooth is like in a defense mechanism. So it starts laying down its dentine inside not to be too sensitive. So then that cuts off the supply. So sometimes you have to be like, well, a detective really, looking at what's going on that tooth specifically. The other thing, like we said earlier, if there's leaky gut going on, if there's not nutrient absorption, if you have the genetic things that don't allow folate uptake or conversion, that the A, D, E, K2, all those minerals that are putting things back into the teeth, the calcium to re-strengthen from the inside out, you're going to be on a more of a demineralization rather than a remineralization process. And that's internal, right?
Yes, yes, and with that, with the oral area, like you can tell, like I didn't know that about the lymph system. That is amazing, because I've always wondered about how an infection or the microbes would actually get rid of the toxicity out of the tooth. I did not know that, Doc. That's amazing.
Love that.
And when you have these all of these things that are going on in the mouth, and you can help increase like the movement of the toxicity, keep the cavities from forming. One of the things, are there specific, well, that's a little too general, because there's certain bacteria. What I've learned is that there are certain tests that you could do to like test your biome. Like, is there like the biome of the mouth, or there's tests that you'd recommend for that? Cause I've heard like different bacteria can affect the mouth differently.
Very true. So how we tend to do it, let's say we notice someone that's got some inflammation in the 2 seconds. My cat has just come in. She wants to
No worries. It's okay. Do it. It's all right. We can edit all this out. It's no problem, brother. I love it. You should bring him on. Bring the cat on. It's awesome.
She's camera shy.
I love it. This is, and don't worry, we can edit this out. This is going great, Doc. I hope I'm not like pressuring you. I just love these kind of questions.
No, I'm loving it. I love talking about everything and how we all come together to support our patients.
Yes.
So the microbiome, if someone comes in, they've got signs of gum disease, signs of decay, disbalance, just not in balance in general, or worse, advanced gum disease, we always do, like I said, easy, low-hanging fruit stuff first. So that's go to the hygiene team, look at the diet, look at the nutrition, look at the Weston A. Price, type of nutrition. And if you guys have not heard of that or read that, look into that, because that to me is still relevant 120 years later.
Yes.
And then look at the brushing, cleaning as well, and look at the inflammatory sources that you're doing, mouth breathing, whatever it may be. Go away, implement these things for 1 month is our minimum, 3 months is our maximum. Come back, another review, see if it's resolved things or not. Because what I like to do is, rather than say, right, you need a microbiome test, you need to do this test, because it's all expensive for our patients, isn't it? So we just do the basics first, just let them regulate how we believe balance should be. And if then it's not resolving, then look into the genetic testing. Are they more inflammatory? Does their body fight things off more aggressively, certain bugs? Because we can all have different bugs living in our mouth. But if my body's more relaxed than your body, my inflammation is going to be less than yours, right?
Yes.
It's not going to be as aggressive to fight things, because gum disease depends upon the bugs that are living in the mouth, but also your body's inflammatory reaction to those bugs. So if we can then look at the nutrition to eat things that calm the inflammatory sources, like your curcumas, your turmeric, your essential oils, your frankincense, whatever else it is, then that's going to dampen your aggressive approach to things. And then if you want to, you can cleanse and restore the microbiome of the mouth by kind of like napalm striking it, I guess. And
Mhm.
then, which is extreme, and I don't do it unless we need to, but then repopulating with good microbiome, good probiotics to try and rebalance the playing field again.
I mean, I really do. I'm really thankful because I love how you say low hanging fruit first. Because doc, like I always tell individuals, like, let's go get genetic testing. Let's go these, and I love it. I'm saying, but I'm like, honestly, I'm like, let's see how much we can clean out of you before we actually go do more testing. Because you've already spent, money, coming to me. I'll tell them,
Yeah.
and man, I can keep going. This is great. When you find like an infection, though, you're doing all the cleaning. One of the things that just popped in my head, though, is like you're saying the airway. Are when you're letting oxygen get in there, are you trying to get more into your into the passageway? Is there any exercises people do? Like, is there anything like you can train the airway? I know you have to get the palate fixed, but is there things that people can do for that?
So there's so much you can, and this is again the easy low hanging fruit before you build up to the more invasive, irreversible procedures. So like how I look at the airway is the cage of the mouth, which the teeth dictate and the palate size dictates, but also the muscular positioning with inside that cage of the mouth.
Yeah.
And let's not forget, behind the tongue, we have a tube that is just muscular in front of the spine behind the tongue. So the tone of that muscle depends on how easily it collapses at nighttime. So what I tend to do before I do any orthodontics, any expansion, any recommendation of anything like that, is that we wear appliances to help us breathe. I'll show you one because I've been doing my calls all day today.
Yeah, and I'll look it over on this side too because I can see it better on this bigger screen.
Yeah, so this is like just I call this a functional appliance. It's got nothing to do with the teeth. It's got everything to do with the airway. And it just moves the jaw forward. It reminds the tongue where to live. It stops the tongue from dropping and blocking the airway, and it stops you from damaging your teeth.
Oh, that's amazing.
And I can do a really quick test to show you the difference here. So if you look at my nostrils, when I close my lips and breathe together, you see my nose collapses?
Yep.
Boxing. When I wear this,
Oh my word! Yes, that is
so
amazing.
nowhere near as much collapsing in that. So I trained. So my first phase of my journey was wearing that to help my nasal breathing, training the tongue to be stronger, to live in the right place, training the tongue to swallow in a way that's not negative to my arch shape, to my breathing, doesn't collapse the airway. And then mouth taping, that was another thing that I got into. But I still recommend that, by the way. But I often say now, if you just mouth tape without using an appliance, without using something to help your nose stay open, you actually sometimes need to breathe through your mouth at nighttime, right? It's your fail safe.
Yep.
So it's one of those weird things that, yes, it may help, let's say 50, 60, 70% of people out there, but for some people it might make you feel worse. So if it's one of you that makes you feel worse, is mouth taping, don't continue to do it. It's your body telling you, maybe I need more expansion, or I need more functional appliances, or I need more exercises. But yeah, exercises, the most simple one that I share online anyway, is like the clicking one. So if you put your tongue just behind your teeth and you lightly suction the tongue up, and then you click down. And you can do 30 back to back, and you'll feel that stretching underneath here, right? Because what that's doing is moving your tongue up and out of the airway so you can breathe more effectively behind it.
That's right there, Doc. I'm not kidding. People out there do that because in Korea, my mom's Korean, so Doc, that's what they do to call the kids over.
I love that.
Truly, that's what they would do. No, this is good. So what's that device called, though? Is it just what is that device called?
It's just a generic off-the-shelf one, but it has to be prescribed by a dentist. It's called a Myo brace. We include it as part of our online course called Airway Stabilization, which does exactly what I just talked about, which is you have a consult online to make sure you don't need more than just this. And we look at your airway, your symptoms, listen to what's going on, and we then prescribe the myofunctional therapy with the appliances to help you breathe at the same time. And you do that for 3 to 6 months, and you see, do things get better or do I need to do more? Because most adults don't want braces, don't want expansion, don't want surgery of any type if they don't have to, right?
That's right. And I mean, I know we have so many. I want to ask you. I know time's getting close, but I just want to ask you a few more questions.
Of course, man.
Is there a correlation, my friend, to the oral health, the microbiome of the mouth, into heart disease? Because I've heard some individuals, like I've had, there's a lot of talk about that.
So much talk. Even in dental schools, they're teaching that now. The most obvious one that every dentist will probably know is infective endocarditis, which is where you have gum cleaning and the bugs go from the gums to the heart and cause infection on the valves of the heart. And you have to have
Oh,
emergency surgery to help repair the valves on the heart. So that is from bugs living in the mouth. But yeah, there's some pretty crazy bugs, like Porphyromonas gingivalis is one. Like the thing is, you can go into all of these like specific types of bugs that have been tested to cause disease. Porphyromonas gingivalis has also been found in Alzheimer's, in the plaques in the brain, right?
woo.
So, we're learning more and more and more stuff about this. Strokes, cardiovascular disease. The way that I look at it is a simple way, like I like to be simple, and just say, if bugs are getting into your bloodstream from your leaky gums, your body has to mount an inflammatory response to neutralize that and detoxify it. And what that does is creates more traffic in the highway of your cardiovascular system, right? So then while
Yeah.
that's happening, a bit like police pulls someone over on the highway, the whole road backs up, right?
Oh, it's beautiful.
Yeah. So then that's happening in your cardiovascular system. So when you're doing that constantly, everything is backing up, slowing down. And when things slow down in our human system, our physiological system that we know, arterioles get what's the word? Deposits in them, plaques. Things just don't function how they should. So that gum disease is the simple, most easy thing that you can support yourself with. And actually, my biggest tip on that one is coconut oil pulling every day.
Oh, that's okay. See, like that's a good point. Like coconut oil pulling. When you put it in your mouth, how long do you usually suggest though for that one set?
So I love the coconut oil pulling for multiple reasons. One is because when you put it in your mouth and you're you're actually pulling it. So you push it with your tongue, you pull it back through, you push it with your tongue. So you're actually training the tongue to help you breathe better because it's moving it out of the airway. But that is pulling through the teeth, onto the teeth. And it's a mild, like the caprylic acid in it is like a mild antifungal, antimicrobial, let's call it, which balances
Mm.
the playing field every single day. So I'm doing it for up to 20 minutes. My routine in the morning is I get up, I have my supplements, have my drinks of water, I put coconut oil in my mouth, I go out and I do exercise. So I'm nasal breathing while I'm doing it because obviously you can't mouth breathe. And then I'm pushing and pulling my tongue as well. And then spit it into the bin and then just brush your teeth, do your normal things afterwards, because that is going to stop the plaque buildup on the teeth as well, because you leave like an oily residue on there that stops the pellicule, which is like what we're talking, like this like layer that goes onto your teeth first before the bugs start attaching to it, and you get all these biofilms building up. So for
Uh,
me, going back to dental school, I did a dissertation? It wasn't a dissertation. It was like a project, and I wrote it on coconut oil pulling, and I got a 49%. They failed me on it because they didn't believe in it. But so much research has come out since then.
I mean, I could ask you questions because people out there. I mean, that's amazing, doc. I mean, literally, that's what I do in the morning. I've been trying. I need to go for 20 minutes, and I
Yeah,
noticed that I did an experiment myself. Like I would do that, and then I went to my dentist, and they're for it. And I was
yeah,
like, well, I want to see if they really make a difference. This is a while back, and I did it, and I'd go get my teeth cleaned. Doc, I go every 3 months. I don't
yes.
take any chances. I'm just getting it checked, and they're like, you don't have hardly anything on your teeth. And then I tried it without it, and then they'd have, oh yeah, you have more buildup. So I'm not telling everybody do oil pulling. What about natural whitening? What do you think? What do you like to do? Just
I've
coil
seen
because the
a lot.
oil pulling does it, doesn't it? I mean, that's what they
Yeah.
say.
Well, the question is, does it physically whiten the teeth? I don't think it does, but what it does is stops the stains from staying on the teeth for sure. So you're every day you put oil pull, you're basically pulling off of the tannins and the turmerics and the things that are in our foods that stain teeth off of the teeth every day. So you're giving it a natural whiten. I personally don't really recommend whitening unless it's causing like like an effect for people. Like they're like, oh, I really hate how my teeth look, and more of a emotional problem. But if we do whitening in the clinic, we use just hydrogen peroxide,
Uh-huh.
which is what our bodies produce on a slightly higher concentration, normally about 6% in a gel. And then you put that on your teeth for a couple of hours. And then in the same trays afterwards, you wash that and rinse your mouth out. You put in the hydroxyapatite, which is what your teeth are made of, to remineralize them straight away. So then you're taking off the layer, removing the stains, adding the layers back on. I've seen a lot going around on the social media platforms at the moment about the bicarb and the hydrogen peroxide at home, the 3% food grade. I mean, I think it would whiten your teeth. The problem is it is like a napalm strike to the mouth all the time when you're trying to balance the microbiome, right? So you've got to weigh that up. And for me, the bugs living in my mouth is what helps me digest my food, which helps me build back my body. Food is nutrition and information and energy all in one, isn't it?
Oh man. Oh, we're gonna have you back on sometime, Doc, if you'll ever come back on, because I know we're gonna get a lot of questions. Um, man, this is fantastic. Okay, so I know time's getting close, but what about the wonder of wellness? Can you tell us about that? I know we had that in your I know time's getting close, but what is wonder of wellness?
For me, here's another like crazy story. I know you like the stories, but
Yeah.
when I was before dental school, we bought the Wonder Wellness URL. So even before we knew what we were going to do in our life, we just had this. My wife, especially, had this thing that I know that we need to just help support people. So she put that was the name of the clinic or whatever else it was going to be. It was Wonder Wellness. So
Yeah.
now what Wonder Wellness? Well, the story of Wonder Wellness was that I started dental school, and then we thought, oh, what can we do? And I was just educating people on how I ate, what I did, the books that I read, the things that I did. So it's more like an online community to start with. And that was educating people using the more natural things first, like I say, before you turn to the pharmaceuticals. So that was like the food, nutrition, essential oils, homeopathy, things that you can do before you need the more intense pharmaceuticals. And then I did dental school, and then I worked for other dentists, learning things. And then we got our first physical clinic, which is called the Wonder of Wellness, which is a biological dental clinic, but working closely. And I don't think the way that we treat people is the only thing to do. Like we have to have, a web of supporting, practitioners, let's call ourselves clinicians, whatever we are. And we have to work with the functional doctors, the Chinese medicine, the acupuncture, the osteopaths, the chiropractors, because ultimately, I always find this, you don't know what's going to be best for that person. So the wonder of wellness is really about, for us, and my wife and I are really extreme about, is just going back to where I was before I went back to dental school. I had no wellness. I had no wonder left. So for me, it was about actually realizing what your full potential is when you're fully well, right?
That's true, and I'm with you. I think that in practice, um, as a practitioner, and it hits home with me, is that you do have to have a form of wonder and investigative, like a wonder, like, oh, I don't want that fire to ever stop, when I'm with patients. Because do you ever get this, Doc? You'll get something and you go, what in the world is that? And then you'll go, oh, no, and then I'll research it, and I'm like, that's why blah, blah, blah happened to this patient, because I just learned it there. And that's
Yes,
the wonder for me. I mean,
absolutely.
oh,
I
okay.
always say to my patients, like, you teach me as much as I teach you.
That is the exact thing, Doc. I mean, seriously, people say, like, all these things. I'm like, no, the only thing I know is that I only talk about my experiences on Instagram. It's
Yes.
what the person taught me. That's only I can talk about. And you can tell that about your Instagram and your website. I mean, we got to have you on again, Dr. Seb, because I know there's going to be more questions. I always like to ask the guest because, like, I mean, you box. This is amazing. Okay, so I know you told us about boxing. What would be something that nobody would kind of know about you? Not like a weird. I'm not trying to get into weird, like, but is there a hobby you like to do other than boxing, or is there something that excites you?
I'll tell you a weird fact that I grew up in the Bahamas for the first 6 years of my life. It was quite cool.
Really?
Yeah. My I've got a bit of a weird heritage as well. My great grandma was from Algeria. My grandma is Swiss, and my granddad is from South America. His heritage, so it's really quite a blend of around the world, which is interesting.
Truly.
Love
Is that where
that.
your last name's such a cool name? Is it Lomas or Lomas? I mean, how do you?
Yes, it's based. Yeah, exactly. I think it means small hill, right? Low
Uh-huh.
mass.
Lomas. Oh yeah. Oh wow. Yeah, Low Hill. Okay. That's
Um, I love that. I'm trying to think what else. My passion now has turned into like personally. You may so two things like from a physiological like how I look after myself from a strength perspective now is sled. Like we do a lot of sled training and pulling. Like so you're walking cardiovascularly at the same time, but you're pulling the weights, doing the exercises
yeah.
rather than just going to the gym just to do weights. I love that because it's functional to me, super functional.
Yeah.
And my dream is when I get time, as you'll probably know, we bought an old farm, a derelict farm, and we don't have all the land yet. We're like in the process of getting more and more as we get more and more. But dream is to be self-sufficient, permaculture. Like that's my passion from the side. You know, you nurture the microbiome of the mouth and the body, and you nurture the soil's microbiome to provide you the food to ingest and to be whole.
Yes. Yep. And so you're putting this all to permaculture, having self-sustainability. I'll swing by one day and have some great vegetable soups. I mean, really, I love these questions. What about one more thing? What's your favorite music?
Ooh, have you heard of a DJ called Sultan and Shepherd?
Yeah, I'm not trying to say I know it, but I have friends who are really into that scene, and they were said, yeah, but I hadn't listened a lot. But yeah, that's
Uh,
your thing. Okay.
that's my thing. And we're actually going to see them in London, so that's gonna be pretty cool. We've seen them before, but they're all about their label is called This Never Happened. So there's no phones, there's nothing. You're just present for the moment. So that's why I love that.
Oh man,
And it's like trancey, chill out music.
I love it, and I would just say like I'm very my heart. I know it's time, but I just want to say my heart like always resonates with my friends from England. I have two really close friends. One's from Brighton, and the other one's
Nice.
from southern area of London. And I wear penny loafers. And one of my friends, and I can't do a good impression, but he talks a bit like this, and he's like, you know what you need. And I was like, what? And he goes, you need some loafers. And I was like, I need loafers. And he goes, yeah. And I wear them. And I'm telling you, and you'll be proud of me. I did get some tickets from Manchester. I'm going to go see Oasis. They're coming to town in
Nice.
Chicago. So we'll see them in August. So, man, again, I just want everybody out there to know, follow Dr. Seb. Please check out The Wonder of Wellness. And if you have a chance to see him, but please, everybody, look at his information because to me, in my heart, like it all starts in the mouth. It all starts up here in this head. So check out the information. Doc, we're going to have you on again. I'm so super thankful. And if everybody likes this kind of information, you have any questions, put it in the comment section, send it to us. Like and subscribe. And if you know anybody that needs this info, send this to them. Okay. So from all of us here at the Ancient Health Podcast, me and Dr. Seb say thank you so much. And Doc, thank you for joining me today.
Oh, thank you. Thank you. Appreciate everything you're doing, buddy.
All righty, my man. All right. See you guys.